Welcome everyone, welcome back to my YouTube channel. In this video, we will talk about the investigations of the gastrointestinal diseases. First of all, we will talk about the endoscopy. Fibroscopic endoscopy is used to examine the esophagus, stomach, duodenum and colon. Video endoscopy images can be displayed on the color monitor. Upper GIT endoscopy after the patient has fasted for at least 4 hours. This is performed under the local anesthetic throat spray. Esophagus, stomach and first two parts of the duodenum can be seen as you can see in the images. And then we will talk about upper GIT endoscopy. Indications are dyspepsia, upper abdominal pain, atypical chest pain, dysphagia, vomiting, weight loss, acute or chronic GI bleeding, duodenal biopsy, and contraindications are atlantoaxial subluxation as in RA. Severe shock, recent MI, unstable angina, severe respiratory diseases. Complications are aspiration, perforation, bleeding. Procedures: explain to the patient with the nature of the procedure, get written consent, tell the patient that the pain due to air inflation may occur and therefore IV sedation may be given, fasting for at least 4 hours. Throat is sprayed with the ligoncocaine, xylocaine. ID sedation for the anxious patient. The instrument endoscope is passed into the pharynx under the direct vision, then down the esophagus into the stomach and duodenum. NPO for 90 minutes after the procedure. Sigmoidoscopy and colonoscopy. Sigmoidoscopy can be carried out either in the outpatient clinic using a 20 cm rigid plastic sigmoidoscope or in the endoscopy suite using a 60 cm flexible instrument following a disposable edema. For the bowel preparations, ulceration, colitis and distal colateral neoplasia can be seen with the sigmoidoscope. After full bowel cleansing, it is possible to examine the entire colon and often the terminal ileum using a longer colonoscope. Colonoscopy indications: suspected bleeding, anemia, altered bowel habit, suspected inflammatory bowel disease, colorectal cancer, surveillance. Contraindications: severe shock, recent MI, unstable angina, arrhythmias, severe respiratory diseases, possible visceral perforation, severe active ulcerative colitis. Complications: perforation, bleeding and cardiorespiratory depression due to sedation. And procedures are 2 days before the procedure start, a low residue diet on the day of the procedure. Take care fluid only. Intravenous sedation with the benzodiazepine. Instrument is placed under the direct vision and maneuvered around to cecum and terminal ileum. Observation is required for approximately 2 hours following the procedure. Indications are further the diagnosis of the stricture, hiatus hernia, gastropharyngeal reflux and motility disorders such as achalasia. Double contrast barium meal. This is performed due to examine the stomach and duodenum. A small amount of the barium is given together with the effervescence granules or tablets to produce the carbon dioxide so that a double contrast between the air and barium is obtained. Indications are given in the screen. A small bowel following through. This is used to examine the small bowel. Barium is swallowed and allowed to pass into the small intestine through the jejunum and into the ileum. This technique is the only way to demonstrate the gross anatomy of the small intestine but takes several hours for completion of the procedure. Indications are malabsorption, Crohn's disease, small bowel edema and barium anemia, as well as plain X-ray abdomen is seen in the image. Gas under the right diaphragm, you can see here AP erect posture, and here is another diagram. Regarding that, if you have any query, you can ask me in comment section. Thank you.